Cornelia de Lange syndrome, CDLS, is a congenital genetic disorder that affects many different systems of the body. It is characterized by physical, cognitive, developmental, and behavioral abnormalities that vary in severity from mild to severe. The effects of CDLS are equal across genders, and the condition is seen in all ethnicities. Most cases of Cornelia de Lange syndrome are caused by mutation in the NIPBL gene and arise in individuals with no family history of the disorder. Prevalence rates of CDLS range from 1 out of every 10,000 people to 1 out of every 100,000 people.
Distinctive facial features include a small head that may be short, a short, thick neck, a low hairline, a small, broad, upturned nose with nostrils that tip upwards, neat arched eyebrows that grow together, long curly eyelashes and/or excessive hair growth on various areas of the body, thin downturned lips, low set ears.
Limb abnormalities include in infants hands and feet that are small for their size, short fingers that become smaller and thinner towards the ends, fifth finger that are permanently curved towards the ring finger, absence of one or more fingers or forearms, thumbs that may be abnormally positioned, and arms that may be permanently bent or flexed at the elbows due to bone fusions.
Intellectual disabilities include delays in acquisition of skills requiring the coordination of mental and muscular activity. They display moderate to severe intellectual disability, demonstrate behavioral problems such as self-injurious behavior, hyperactivity, short attention span, oppositional or repetitive behaviors.
Children with CDLS often demonstrate hearing impairment and abnormal speech development, including chronic middle ear infections, difficulty speaking, i.e. dysphonia and/or apraxia. Severe speech delay is also common, and older children may have abnormally hoarse speech.
Infants display low birth weight and may fail to gain weight or grow at the expected rate. They may demonstrate delayed bone age, exhibit short stature, and exhibit additional skeletal abnormalities. There's also abnormalities of the gastrointestinal system, including gastroesophageal reflux disease. They may be at risk for abnormal twisting of the intestines, potentially leading to intestinal obstruction, and some babies can be born with diaphragmatic hernias.
Malformation of the genitourinary tract may also occur in children with CDLS. Males may present with underdevelopment of the genitals, failure of both tendes to descend into the scrotum, and/or abnormal placement of the urinary opening on the underside of the penis. Females may present with abnormal development of the uterus and irregular menstruation. Individuals with CDLS often also have increased susceptibility to heart abnormalities, eye abnormalities including myopia, nystagmus, and ptosis. They also have increased susceptibility to repeated respiratory infections and seizures.
Occupations that are typically affected by this condition include ADLs such as feeding, swallowing, and chewing difficulties. Individuals may experience episodes of severe, forceful vomiting after feeding, issues with dressing, donning, and doffing clothes independently, communication difficulties, and behavioral issues associated with CDLS may hamper the child's engagement in satisfying reciprocal social interaction with others. They also may display difficulties with sensory processing, motor planning, and/or self-soothing may impede engagement in play activities. Intellectual disability and/or developmental delay may affect individuals as well.
Typical medical intervention includes addressing feeding difficulties through use of supplemental formulas and/or a gastrostomy tube. Also, nutritionists often help caregivers provide a diet that meets the child's individual nutritional needs. Typical therapies involved include physical, occupational, and speech therapies. Focusing upon just occupational therapy, OTs may address sensory integration, social participation, play participation, and communication. OTs may also assess the child's need for assistive devices, address positioning needs, and help develop the child's IEP.
Surgical interventions include gastrotomies, correction of intestinal malrotations, limb corrections for surgeries of limb malformations, orchiopexies, cardiac surgery, and pediatric dental treatment for cleft palates.